My name is Jamie Smith. I am your host today on Nurse Dex, and today I'm excited. We have a Casey here. Casey, can you tell us a little bit about yourself?
Absolutely. And my name is Casey Smith, and I'm so excited to be here. I was a pediatric ER nurse for about 6 years before joining Trusted Health, where I now sit on their commercial team. So I connect with healthcare facilities across the country and help them develop innovative solutions to manage their nurse staffing right now. But I've worn many hats at Trusted, including when I first joined, I actually joined their marketing team and helped them build communities. So I know that community is a really big thing for Nurse Dex, so I'm happy to kind of talk through that today.
We're happy to have you here. So tell us, how did you get started as a nurse?
So I think that when I didn't really know I wanted to be a nurse, to be quite honest. So many people have such impactful stories about how they had some life-changing experience or knew someone that received really wonderful care. For me, I was just really, honestly, I was just trying to figure out where I could combine my interest with, which were at the time science. I loved science in school. I loved people. I think I wanted to be a physician, but I didn't really understand what that actually means. I think a lot of people think they want to be a doctor when they grow up, and then they actually understand what that means and they kind of deviate from that. For me, I really wanted as much hands-on care with people. I've always enjoyed caring for people. I have two siblings and a very loving family. And so I think that came very naturally to me. So when I was interested in a career, nursing just seemed like a good fit. But I can't say that I was 100% confident that I was going to absolutely love it. But fortunately, it has been the best career I could ever ask for. And as soon as I was actually on the floor with my patients, I was like, oh, this is where I'm meant to be.
It feels good to get into a profession and be able to say that. It's good to know that this is where I'm meant to be.
Yeah, absolutely. It is. And the reason why I say I didn't know and wasn't sure is because I wanted to make the people who don't know and weren't sure. Like I want to normalize that, because I feel like so many people have these really wonderful, beautiful stories, but mine was pretty simple. I just like, oh, this seems like it might fit. And it did, luckily for me.
So can you tell us about your journey as a pediatric nurse?
Yeah, I'd love to. So I graduated from UNC Chapel Hill. I did my nurse residency program at Vanderbilt in Nashville. I started off in the pediatric ER. I joined their specialized critical care and trauma team pretty early on. I think I was one of their youngest members to join ever, which is really great and was really exciting, but it was also really hard. And so it's pretty early on in my career and at a young age, because I graduated school when I was 22, I was taking care of the sickest kids on the unit. And I was experiencing a lot of patients' deaths and, having to console and navigate that with parents. And I think that at the end of my 2 years at Vanderbilt, I was already a little burnt out. I think I had about 3 deaths my last week there. And it was no fault of Vanderbilt or my staff there. It's just, it's just the nature of being a part of that team and understanding that these were the responsibilities of that role. And so I was just looking for a little bit of a change. I always was interested in travel nursing. And so at that time, I started travel nursing. I did my first assignment at a small 10-bed ER in Austin, Texas, went on from there to San Diego, up to San Francisco, back to Austin, up to Seattle, Phoenix Children's, and then back to Austin. So I really, really enjoyed my tenure as a travel nurse. I was doing it with several of my good friends. I love exploring new places. I really developed a love for travel then, developed a love for hiking. I was exposed to so many new facilities, new people, new ways of delivering care. I learned so much along the way. It was such a beautiful, beautiful time in my life. I tell some people I peaked as a travel nurse. It was just so fun and it was so great and I learned so much. It was hard at times. I don't want to romanticize it. There are some parts about travel nursing that are not fun. But I really enjoyed my time there. But at the end of that time, I'd taken my last assignment with Trusted Health and I love the company. I had developed a rapport with Sarah Gray, our founding clinician. And so when she reached out to me about a position on their marketing team, I was a little bit burnt out at the bedside, but I wasn't quite sure if I was ready to leave. But then I was like, nah, I don't know if there'll ever be another opportunity where I will be given to jump industries like this in such a niche position. and also an opportunity to care for my other nurses out there. So I took the leap. Wasn't sure if it was going to be the right fit, and I've loved it, and I've been trusted for over 2 years now.
Wow. So that actually answers my next questions. I was going to ask, what made you shift from pediatric nursing to commercial and community?
Yeah, so I can add a little bit onto that. Is, I originally started to kind of manage their Instagram and to start building community there. And once I started doing that, I was like, oh, this is really special. This is something that I haven't really come into contact myself before. And as soon as I really got into it and started hosting events and bringing nurses together and seeing the impact it made for nurses, I was like, oh yeah, I love this. I can do this for a lot longer too.
Tell us more about it. I want to hear more about Trusted Health, its mission, and how it's different from others.
Yeah, there's a lot of things that set us apart from other companies out there. And I love talking about Trusted because, it's been my family, my home for the last 2 years. So Trusted, our mission is to help people get care. We do that in a couple of different ways. The one side of the company that most people are familiar with is our nurse staffing side. We've essentially digitized nurse staffing so we can help connect travel nurses with travel positions across the US. And the way we do that is through innovative technology, which takes the nurses' preferences and matches them with jobs that are available on our platform. The way that it's different is that it gives nurses complete autonomy and control over their careers. We provide transparency, provide all the details of the assignment, including the full pay breakdown, everything they need to know to make an educated decision and make the best decision for themselves. So instead of the recruiter model, our employees are nurse advocates and clinical success partners. There's no incentive for them to push nurses into assignments that maybe aren't the right fit for them. It's not a commission-based structure. And so our main goal is to support our nurses. And then another differentiator is going to be the fact that our nurse advocates and our success partners, they are nurses themselves. So our care team that supports our nurses on assignments are made up of nurses themselves, and they really understand the clinical side of things, and they really understand the pain points for nurses. A lot of us used to be travel nurses as well, so we understand that dynamic, what nurses are going to be entering in facing when they enter into the hospitals. And so we just get it, I think, is a big difference. And then on the other side of the company, which I now work on, we're developing technology to help hospitals better manage their workforce more efficiently and more effectively. It saves the hospital money, and then it also in return can help hospitals with staffing, which ultimately is going to be helping our nurses and our patients. And so at our core, we're kind of a technology company. And so I'm more focused on the kind of the hospital and B2B facing side right now. But ultimately the impact is to help patients and everyone get care.
Wow, that is a lot.
Yeah.
So I want to make sure I understand. So Trusted Health is about nurse staffing. It helps with matching jobs for travelers, those who are looking for jobs. And these people are actual nurses, so they understand the process, the dynamics. And there's no incentives for the nurses for giving these other nurses jobs. So you know that they're giving them jobs because they truly believe that this job is what's right for them. Is that correct?
Yeah. So essentially what we're doing is giving them the access to these jobs and giving them the information so they can make these decisions for themselves. And then along the way, since travel nursing is a scary and is kind of a complicated process, we have nurses there who really understand it to help support them along the way, which is really exciting. And, I think that this is going to be the future of how we do travel nursing and using technology to help support our nurses and our patients. So I think it's really cool, and it's shown to be really effective. As a nurse myself, I really appreciated it.
Oh, yeah.
And you can just tell when you're working with our nurse advocates and clinical success partners that, we're really nurse first. Our company is 20% nurses internally. We sit all across the company. And so a nurse touches about every decision that comes across the table, and our input's very, very much valued.
Oh, yeah, especially because it's nurses helping nurses. And so they get it. It's a connection there. I'm sure that impacts retention too.
Oh, yeah, for sure. We have nurses who've taken quite a few assignments with us.
That says a lot, especially if they keep going with the same people, you guys.
Yeah, the fact that they've extended so frequently definitely makes us feel good about the work we're doing.
So how is Trusted Health helping nurses to build the lives they want? Thank you.
Yeah, well, we do it in a few other ways too. We're multifaceted. We try to take care of the nurse holistically. So we obviously have this jobs platform and help them with their careers, but we actually provide a lot of career resources. We have been developing our community, obviously, which I used to work on. So we host live and virtual events, which cover topics everything from lifestyle, meetups, to career resources. We really try to cover topics where I feel like there's gaps of information for nurses, like travel nurse taxes, LGBTQ plus, nursing in the wild, like how to be a wilderness nurse, cannabis nursing, like all these different topics. Yeah, so we partner with a lot of leaders in the industry and provide really good content on our blog, through these events, on our social channels. We have, if you have a profile with us, we have community forums where you can connect with other nurses. We also have a Facebook group with over 10,000 nurses, for them to connect with each other there. Our community efforts are pretty large, and we do a lot to help support nurses. We also, like I said, we really try to be nurse first in everything that we do. In our benefits, we do day one benefits for our nurses, and that also includes mental wellness benefits. We have access to at least 5 different services and apps to support their mental health and wellness.
Yeah, you caught my ear when you said nursing in the wild. That
Oh
sounds.
yeah. So for anyone who's watching, we partnered with the Wilderness Medical Society. I'm actually a member. I love them. They're amazing. They are the world's leading resource, and have the leading research on how to manage illnesses or manage care in the wild. So if you are an ER nurse, or if you're interested in pre-hospital care or how to treat something in the wild, or you're just outdoorsy, this is like your community. This is your place. I love them so much. They bring in the most interesting people, and they're not just interesting. They're like the kindest folks you've ever met. I absolutely adore them. And it's like the director of emergency care for all of Alaska, who also teaches survival skills or hypothermia classes for us. It's so cool. I just think it's the coolest thing. So we try to find partnerships like that to help bring really interesting and unique content for our nurses. And it's been fantastic. I think those partnerships and understanding how to connect with the broader community to help support our nurses has been really impactful for us.
That's pretty awesome. So you do more than just help people get jobs and travel assignments. Sounds like you go above and beyond. You're a support for other areas too. So
yeah, we do our best, and we have, like I said, all those resources, and we really try to hit upon more than just the bedside, like lifestyle and any other topic that can help support our nurses. We really aim to cover.
So can you tell us more, Casey, of your career highlights in Trusted Health, from being a community associate to community lead and now a senior business development representative?
Yes, I've worn several different hats, but they've all been amazing. I started off, like I said, I was just managing their Instagram and hosting live events for them. When the pandemic hit later, I transitioned to more of a social media manager role. I was managing all of our social channels. Then I was also helping to develop and execute our our virtual event strategy. So that's when we started finding all these partnerships with, like I said, the Wilderness Medical Society or the National Black Nurses Association, to bring events and content for nurses to access virtually, since we weren't able to meet up with each other. And that was really impactful. And then towards the tail end of my tenure, well, actually my last year, on the marketing team, I created and ran our community ambassador program. And that's taking bedside nurses who work for Trusted, who love Trusted, who understand the pain points and everything that's going on for nurses at the bedside, to bring real authenticity to our marketing efforts, to our efforts within Trusted, and making sure that we're connecting these nurses in the way and reaching out to them in a way that they'll resonate with, but also a way that's truly helpful to our nurses. Because, even after 2 years away from the bedside, I still remember acutely like what it's like to be a nurse, but to be a nurse in the pandemic, understanding what they're going through, I think that's the right person to connect with our nurses.
Mm-hmm. Well, I want to hear more about the Trusted's first community ambassador program that you launched.
Oh, okay, awesome. Yeah. So we started off with 3. We did a pilot program. It was really successful. And so we expanded it to 10. We picked a variety of nurses across different specialties and backgrounds and essentially helped brought them in and used their insight and their innate ability to connect with other people across our social channels, our blog. They write content for us. They create social content for us. If you go to our Instagram, you'll see reels from Kaylin and Jerry and Ashley and all of our community ambassadors. And they also help us host events because nurses, whether you realize it or not, you have something to offer. You are an expert on something. So they've been able to lead events and offer insight on travel nursing or what is it called? Medical volunteering, things like that. So we have a really great group of nurses that help us across in all those different ways, and they continue to help us internally at Trusted through focus groups and other things like that, of that nature. So it's a really great program. We're going to be looking to expand it and bring more ambassadors in, and just help them help us continue to make an impact.
Is there a website?
We do have a community ambassador page. You can access it from our trustedhealth.com website and go to community, and you can see a list of our current ambassadors.
Cool.
Okay. You maybe need to update it to add a few of our new ones, but that'll continue to kind of change and evolve and grow as we grow the program.
So how was it working and partnering with influential nurses on the content, events, and social?
Oh, it's amazing. It's so great. It really is. I mean, you realize you have there's this broader community out there for nurses that really want to help. I mean, nurses are wonderful people. They're our people, right? Like I go to these conferences and I find a nurse and I'm like, oh, I talked to them for 5 minutes. I'm like, oh yeah, these are my people. They get me. They understand me. And so you work with these influential leaders and these role models, and they're really willing to break things down, or they were willing to pass on any knowledge and help me out, in my current role, but also just serve as a mentor beyond. So I really appreciate everyone I've worked with. I tried to be as much of a sponge as possible to soak that up. And I think by working with them, I really was able to expand my horizon to understand what I'm capable as a nurse. These are nurses that are going out there doing things that nurses have never done before, and just showing that we're capable and we have the skills and we have the know-how to do these things. So that was really impactful for me in understanding that I can really do anything I want with my career now. I just got to figure out what that.
Well, it's obvious you're passionate and you're driven. I'm interested in knowing, based on your clinical experience and your work with Trusted, how do you see yourself progressing in the future? What do you see happening upcoming?
I had this conversation with someone the other day, and I don't know is the short answer. And I also like saying that I don't know things because I think it normalizes it too, going back. I don't know what I want to do when I grow up. And I also realize that that's perfectly okay. I had a meeting with a mentor, a month or two ago, and I came in, I was like, I don't have a 5-year plan. And he was like, that's okay. Like, you're actively growing, you're in a role, you're changing roles, you are growing your skill set, you're making impact, like focus on the now, really develop his skills, learn as much as you can, and maybe you'll eventually come across a thing in the future. And I think that similar position to me, I'm always jealous of those people, by the way, that are like, I know exactly this is what I want to do, because I am not one of those. I love to accept opportunities as they come, and I'm really grateful that I have that part of my personality, because I think it's led me to where I'm at now, and I don't know if I would have gone down this road otherwise. So if I have any advice for anyone out there, just look for the opportunities, take them outside your comfort zone, because growth is uncomfortable. It is it's very uncomfortable, but you're going to be better because of it, and your horizon is going to get bigger and bigger and bigger, and you're going to be able to accomplish so much more because of that. So don't limit yourself.
I could not agree with that statement more. You got to have courage. You got to face what scares you and just put yourself out there, and you'll be amazed at what happens.
Absolutely. Yeah. It's been a wild ride, but I'm better for it.
That's right. So, what would you say are the biggest challenges that nurses are facing nowadays?
The biggest challenge that nurses are facing nowadays, I think there's a lot. I think that healthcare is broken in a lot of ways. We're the we're not given the support and resources that we always need to grow. I think that professional development is scarce in nursing, and I don't understand why we don't start that at the collegiate level and really push that and develop them as leaders and as professionals. And so that if they want to make an impact beyond the bedside, that they're able to. I think right now we train nurses to be at the bedside because we need nurses so direly at the bedside, but we're limiting them. And I've seen so many nurses leave healthcare. In reality, we just train nurses a little bit better and gave them the education to exceed elsewhere. We could at least keep them in healthcare. And nurses have been shown to make so much of an impact in healthcare. And I'm getting on my soapbox here, so I apologize. Lots of hand motions, but nurses are there for the patient journey. All these companies look at physicians and hire physicians to help guide them. They should be hiring nurses. We need nurses in other parts of healthcare to drive change. We really, really need them to help be a part of decisions at all levels. And if we train nurses only to be at the bedside, it's going to be so much harder to get them there. And that's, I think, a problem with our education system. And that's something that, I was talking about today. I was like, I would love to get into education and help make that difference down the road. I'm not quite sure, but that's definitely something on my horizon, hopefully. But also going back to like the broken system, I think that we were like, from an operational standpoint, hospitals are really old school. They don't have the technology they need to bring us into this decade even. And so that ultimately hurts our nurses and patients. And I think that the way that sometimes hospitals commoditize nursing, hurting our profession. And I think that if we spent more time developing and focus on retention and staff and really supporting them, hospitals and patients will be better off. But I don't really fully understand. I can't say I really understand like why that doesn't exist and why that's so hard for some facilities. I don't understand it, quite honestly, because it seems so black and white to me. I know there's a lot to gray there, but for me, it's very black and white, and I don't really understand it.
Same here. You brought up the mentions of the key word for me is education, and really focusing in on education, and not just focusing on making nurses for at the bedside, but also professional development and how important nurses are. They're mandatory. You got to have nurses at all levels. So I respect your comment on that. I actually got goosebumps when I heard you talk because you said it so perfect.
Thanks. I appreciate that. Like, that's something, like I said, I feel very passionate about. And, and I think that there's a little bit of a disconnect and maybe it's a generational thing where what is expected of nurses today is so different from what was expected 10 years ago, 20 years ago. I think it's becoming harder to nurse, and we need more and more resources, always getting them. And I think that should start, like I said, with education at the beginning of our careers.
That's right. You're exactly right.
Mm-hmm.
So how has COVID changed your work?
I was remote to start, like in the marketing position, but then I was doing these live events. I was hired to do live events and to start building a community in person, but then I went completely remote. So I wasn't as impacted as much as most nurses, who were doing bedside. But I will say that I think about every nurse internally I trusted we kind of went through it mentally, just because we have these skills and we know we can the bedside, and we felt so guilty for not being there with our fellow nurses. And so it was really hard for us for a little bit, and we talked about it, and we're like, should we be them, but then we can support them on this side? We feel like we're leaving them there by themselves. That was really hard for us. Not as hard as what nurses are, and not trying to discount what nurses experience at bedside, because I think that was much worse, but we were impacted in a very different way.
Yeah. So, what are your thoughts on the community, and how do you think nurses can benefit from the Nurse Dex community for nurses?
Nurses can benefit from it in a lot of ways. You have that support system, and you can reach that support system anywhere. When you are on an assignment, or you're having a bad day at work, or you're with your spouse or children or family who don't quite get what you're going through, you still have your fellow nurses there to support you. And I think also, to expand upon that, to kind of normalize what you're experiencing. I've seen a lot of mental health issues come up for nurses, and for people across our population. Mental health is a big topic and issue right now. And so just having a community to go to that normalizes what you're feeling, because, compassion fatigue and moral injury, those are really scary to navigate. When you stop caring as much for your patients and don't feel like you have the capacity to care for them in a way that you used to, and you feel like something's wrong with you, when realistically you've just been subjected to a lot of trauma.
Yeah.
And that's really scary to feel, and you feel bad about it. You can talk to nurses and understand, like, this is not just me, this is something that's happening across the board. Normalizing those experiences, and maybe even making you more likely to seek help when you need it. So I've seen that in a good way. It's just like normalizing what people are experiencing, connecting with each other, connecting to people who understand. And then I think beyond that, I think humor is a beautiful way to, and a great tool for handling, the hardships of being a nurse. There's obviously a fine line there between crossing that humor and not, and you have to be careful as a professional, but using humor to express that and sharing that to, I think can be a good outlet for nurses. And so I think that's a beautiful part of it, especially an online one like Nurse Dex. And then also, for me, what I've seen specifically is I can find the professional development and the mentorship there that I didn't get in my education or, elsewhere. I see nurses doing things that I want to do. I see nurses going beyond like what we were, trained to do. And I think that's really a beautiful thing to understand, and to meet those people and to get their advice on how to take the next step for your career, because that exists there, even if it's harder to find it elsewhere. And that mentorship is a beautiful thing.
Yes, it is. Also, going back to Nurse Dex, they have Nurse Dex Social, ND Social. If you go to social.nursedex.com, it's about building genuine connections within the nursing community, just like you said. And you can also create groups. You can share resources, stories, trending topics, and whatever's on your mind. It's a place to feel authentically seen and heard. So it's like Facebook. Yeah.
That's a beautiful thing. That's an absolute beautiful thing to have that and that ability to connect with other nurses. So I definitely encourage people to check that out.
For sure. So how will you motivate nurses to help create a better environment by joining a community?
I think that people throw around the word community a lot. So just helping them understand the benefits of joining one and what it looks like. You just get them there. I think that's the hardest part. It's not a build it and they will come.
Yeah.
It's not like that. Nurses have to understand what they can get out of it. And so I think that nurses are really word of mouth. So bringing in people who love, the community and helping them spread the word, bringing their friends and family, and understand that it is each person's responsibility in that community to help build it and contribute to it. Put that responsibility and accountability on each member, I think is also really important. Like, it's their job to moderate, to make sure people are speaking kindly, to build this, to share content, to share ideas, to share good vibe. It might be, it's also like they're a part of that community and they're responsible for it, and putting that accountability on each individual gives them ownership, and also I think helps build the community.
Thank you for that. I love your response to that.
Awesome.
Yeah. So we have one more question for you, Casey. What are your thoughts on clinical practice versus community building?
I think they're both wonderful. I mean, being a nurse at the bedside is probably the greatest honor I'll ever have. I mean, I mean that so sincerely. I being able to care for vulnerable is such a beautiful thing. And I am just so honored that people put their trust in me to care for their sick children. Like, that's a really big deal, and I absolutely loved it. But building community and understanding the importance of that and helping other people understand and seeing the impact that's been able to make on our nurses' lives. And then also on, nursing students and new nurses, and having them feel supported when sometimes they don't always feel supported at work or elsewhere. I think that's also really beautiful and beautiful and really impactful. And I think that it's both are necessary and needed.
So Casey, thank you for your time here today. I'm really impressed. I'm just sitting here thinking about all that you've done in your life. You became a pediatric nurse at 22. You trained at UNC, and then you became a travel nurse. And then you ended up shifting over to working with Trusted Health from being a community associate to community lead. And now you're a senior business development representative, and you're doing big things. You're helping nurses get assignments out in the world. Plus you're going above and beyond. You're being a resource for people. And I'm going to have to look into this nursing in the wild because I'm still stuck on that. It sounds pretty amazing. You do a lot for nurses, and I respect how it's nurses working for nurses. So they know that whatever assignment you're getting, it's because they genuinely know that this is the best assignment for them. So thank you.
Oh, well, thank you. That was very kind. I love what I do. Any nurse can do it. I really think so. I mean, it's just believing in yourself and having the people to believe in you. Like, you can make an impact beyond like what you really probably can recognize right now. And it's the same for every other nurse out there. And so I just really encourage nurses to take chances, take risks, join a community, start talking to people, and just understand that you can do whatever you want to.
Yeah. And I'm just sitting here thinking about how much of an inspiration you are, because if people are listening to this podcast, you talked about not being 100% sure what you wanted to do. You wanted to help people, but not necessarily a doctor. So you became a nurse, and look where it's got you. And you ended up mentioning, being courageous, stepping into things that scare you. You got to do it. You got to take that chance, that leap of faith, and working hard and believing in yourself. So thank you for those comments.
Thanks. My favorite thing in the world is to empower other nurses. So if I can do that on,
it shows.
So even if I can do that on a small scale, I'll be happy. So thank you for this kind words. So I really appreciate it.
Well, thank you for your time today, Casey Smith. And that's all we have today on Nurse Dex. We'll see you on the next episode.
Sounds good. Thanks, Jamie. I appreciate your time.
Yeah, take care. Bye.